First, to develop mutually beneficial partnerships across country borders. Two, to facilitate in a systematic way, more systematic than anything we've ever done, the exchanges of information and personnel. I recently had an opportunity in Argentina to visit and take a delegation to begin dialogue about how we can create stronger bonds for the sharing of information and cooperating to address problems that face this world. The third thing that we would do and have as a goal is the creation of a virtual center for collaboration, where 6 countries actually come together, or representatives for those 6 countries, and create what amounts to a virtual center for collaboration. The fourth goal is to encourage joint patent activity and joint venture development. In my visit to Argentina, I was hosted by a division head at Lalor Institute, Lalor named for Nobel Prize-winning biochemist, who has a joint patent application with a faculty member from UAB. We want to encourage further development of that. We just received at our incubator facility, the Innovation Depot, the designation of a soft landing technology incubator. Soft landing provides an opportunity for a startup international company to land in the depot and be supported by the depot to access market in the U.S. Sixth goal is to cooperate in support of the development of technology policy across the borders. And finally, to share expertise on public-private partnerships for innovation. Initial data and information indicates of the 6 countries that we are interested in cooperating, 3 of the 6 already are thinking seriously about joining the alliance. We're excited about the future. We're excited about what we can do by joining together across borders to develop new technology, implement those technologies to deal with problems that face populations from around the world. Thank you very much.
Thank you very much. I think we heard the 3 words to take home: cooperate, collaborate, innovate. I'll have the distinct honor of introducing our next speaker, who will be discussing the responsibility to innovate. Mr. Mark Probst is the CIO of Intermountain Healthcare and the co-chair of this session. Additionally, he's been appointed to serve on the Federal Healthcare Information Technology Policy Committee, which is a policy committee assisting in the development of health information technology policies for the United States government. Mark has been involved with information technology and healthcare services for the past 25 years. Prior to serving as Intermountain CIO, Mark was a partner with 2 large professional services organizations, Deloitte Consulting and Ernst & Young, serving healthcare providers and payer organizations in the United States and around the world. It's my distinct pleasure to introduce Mark Probst.
Okay, thank you, Asif. I appreciate it. And Dr. Portera, that was excellent. I really appreciate his words. He didn't mention, though, he's with the University of Alabama, and I don't suppose all of you follow American football as closely as I do, but if you did, you'd know that the University of Alabama has the national championship football team in the United States, so that's pretty neat. And then he didn't know, and I'm a little shocked that he didn't know, that my daughter went to the University of Alabama and played soccer there. And she actually holds 10, so football in your parlance, she holds 10 of the offensive records at the University of Alabama for soccer, so that's pretty neat. I want to tell you how, one, honored I am to be here, but two, how humbled I've been to listen to the words that were spoken thus far in this conference. I'm humbled for multiple reasons. One, 222 hospitals implemented in a single year, and I worry about my 23 hospitals. Unbelievable, the amount of work and the brain power and the effort that's being put in. I'm humbled by telehealth and telemedicine and learning about Dr. Reddy and the first use of telemedicine here in the country of India. To 10 years ago, over 10 years ago. We're just getting started. I'm humbled by just how tremendous of brain power and effort that's gone in this country. And then mostly I'm humbled by the purpose of this meeting. This hasn't been about how to make companies larger or more wealthy. This hasn't been about who has the greatest technology. This has been about a purpose, which is how to improve health care and use information technology to do it. And I'm honored to be here. I represent Intermountain Healthcare. I am their Chief Information Officer. Intermountain Healthcare has 23 hospitals. We have about 150 clinics. We have a health insurance company. So we are truly an integrated delivery network. The care we provide is paid for within our own network, primarily for the people we serve. We serve the state of Utah. Utah is kind of in the western mountain section of the United States. And as you think about the number of people you're dealing with, our whole state has about 3 million people in it. So our population is much smaller that we're dealing with. But if you were to go to Utah and you had acute respiratory distress syndrome, now hopefully you don't, but if you did, the chances of survival at Intermountain Healthcare would be 4 times greater than any other institution in the United States. If your child needed to go to the neonatal ICU unit and had a ventilator put in your child, that child, on average, would have that ventilator removed 24 hours before any other children's hospital in the United States. If you had sepsis that was indicated as you came into our emergency department, your chances are significantly greater that that sepsis will be treated and you will not have the, death that would come from an appropriate sepsis indication. If you are a mother and you're having a child in Utah and come to an Intermountain Medical Center, the chances of your child ending up in a neonatal ICU unit are about 6 times less than most organizations in the United States. Quality is pretty high. And did I mention we're the lowest cost provider of health care in the United States per capita? Some things are going right there, and I'd like to talk to you about a few of those things. I don't believe today I'm here to educate, because there are far wiser and smarter people I've learned in this room, but maybe, just maybe, motivate around some principles that I believe are incredibly important about healthcare. Quickly, let me tell you about our information systems organization. Since I'm the Chief Information Officer, we spend about $200 million a year for the 23 hospitals and all the clinics that we serve. And you can see some of the numbers that represent what we do in information systems. Again, I reflect on 222 hospitals being implemented, and I use this slide to complain about the 500 projects that we have going on. I don't think I can go home with quite the same attitude. There's a lot happening in healthcare around the world. In the United States, with the advent of meaningful use, and the Healthcare IT Policy Committee I serve on, if you like meaningful use, we're the committee that formulated meaningful use. If you don't like it, well, we'll blame some other committee. But that is the committee that we work on. Those policies are creating tremendous work within the United States, tremendous effort around electronic medical records. In fact, we're putting $35 billion of government money into the implementation of electronic medical records. The technologies are changing so rapidly. I've looked at everything from iPads up here to iPhones to the internet to all the different devices in telehealth. Everything's changing rapidly. So as a CIO in healthcare, it's complex. The expectations of our users, 10 years ago, physicians didn't really care that much about computers. And in fact, it was an imposition to provide them to them. Today, the expectations are high. They want those computers, and they want them to do specific things. All of these things together create an environment that's incredibly complex, but one that we have to work in and one that we need to succeed in. I believe, as healthcare providers and as technical people, we have a responsibility to innovate. Thomas Edison, the inventor of the light bulb, said there's a way, and not the light bulb, yes, the light bulb. There's a way to do it better, find it. Find it. Imagine for a second, your daughter's in Fiji, good place to be, has a fever of 104 degrees and is a type 2 diabetic. She needs to see your family physician. Telehealth is an answer. She doesn't need to see any physician. She needs to see the physician that understands her. She has chronic illness that, if properly taken care of, will enlong her life. But this care needs to be taken care of. Again, I'm very impressed by what's being done with telehealth here. At Intermountain Healthcare, we're really just beginning in the use of telehealth. We started a project about a year ago with Microsoft to develop telehealth capabilities. Now, what we found was it was relatively easy to get the video and get that conversation, and even to get the electronic medical record information in front of the patient, or to the patient and to the doctor. What we couldn't do was put a telehealth call on hold and then route it to someone else. So through our innovation lab, we developed the capability to put it on hold and route it. Not nearly as sexy as some of the things that we've seen today, but very important if the phone call's coming to a lower level clinician and it needs to be raised to a higher level clinician.